What if the reason your tinnitus has not improved isn't because it's untreatable, but because your treatment plan was missing key pieces? Today, I'm going to show you why tinnitus usually requires multiple treatment strategies working together, and how as a Modern Tinnitus Specialty Center, our clinic approaches care differently from other hearing care clinics, and how you can finally get the relief you've been looking for. This is not theory. This is exactly how I've helped thousands of patients over the last 2 decades get their lives back. I'm Dr. Layne Garrett, founder of Timpanogos Hearing Tinnitus in Utah. I'm proud that our clinic recently became one of the first Modern Tinnitus Specialty Centers. For over 20 years, I've specialized in helping patients manage and reduce their tinnitus symptoms using multiple coordinated treatment methods. Tinnitus is not a one-size-fits-all condition. It's complex. Part hearing system, part brain, part nervous system. That's why the one-tool approach you often see in regular hearing care clinics simply isn't enough. Many hearing care providers advertise that they treat tinnitus, but for them, treatment begins and ends with hearing aids. Hearing aids can be a hugely important part of a tinnitus treatment plan. Around 90% of people with tinnitus also have some level of hearing loss. By amplifying the sounds around you, hearing aids give your brain more to listen to than the ringing in your ears. It's like turning up the volume on the world to help drown out the noise in your head. But here's the crucial detail that gets missed over and over. Chronic tinnitus is not an ear problem. All the latest research shows it's fundamentally a brain problem. It's the brain's over-the-top reaction to the change in hearing. Here's an analogy I use with my patients. Think of tinnitus as a faulty smoke alarm that's stuck on, blaring 24/7. A hearing aid-only approach is like cranking up the TV to try to drown out the smoke alarm. Sure, it might distract you for a little bit, but it does absolutely nothing to fix the smoke detector. The underlying issue, that hyperactive signal, is still there. Worse, it doesn't do anything about the panic and stress you feel from hearing an alarm all day long. You see, the suffering from tinnitus isn't just about the sound, it's about your brain's reaction to it. Your limbic system, the emotional command center of your brain, flags this internal noise as a threat. It's dangerous. That triggers a fight or flight response, pumping you full of stress and anxiety, which only makes your brain pay more attention to the tinnitus. It's a vicious cycle, and just making the world louder doesn't break that cycle one bit. If your treatment plan only gives you amplification, you're addressing just one piece of a much bigger puzzle. If you're finding this video helpful, please give it a like. While you're there, hit the subscribe button with the notification bell hit. That way, you never miss any of the videos that we put out weekly on hearing and tinnitus care. Thanks. If hearing aids alone aren't the answer, what is? The most successful evidence-based tinnitus treatment plans are based on 3 core pillars, supported by major clinical guidance and confirmed by over 20 years of my own clinical experience. Think of it like treating high blood pressure. You often need a combination of tools, medication, lifestyle changes, and stress management all working together. Tinnitus really is no different. This is so much more than just amplification with hearing aids. Strategic sound therapy uses sound to retrain the brain, not just mask the tinnitus. The goal is something called habituation, training your brain to reclassify the tinnitus as an unimportant sound so it fades into the background. Think of the hum of your refrigerator. You know it's there, but your brain tunes it out. That's exactly what we're trying to achieve with tinnitus. Tools in this pillar can include modern hearing aids with tinnitus programming. The right hearing devices, programmed with the right sound therapy and verified with real ear measurements, can gradually reduce perception of tinnitus over time. And note, over-the-counter hearing aids are not FDA approved for tinnitus treatment. Tinnitus retraining therapy includes pairing sound therapy with counseling to change the brain's reaction to tinnitus. And linear bimodal neuromodulation is a groundbreaking FDA-cleared device that delivers sound stimulation to the ears and gentle electrical stimulation to the tongue to retrain those tinnitus pathways in your brain. Pillar number 2, taming the brain's reaction. This is the most overlooked but absolutely essential part of tinnitus care. If your brain is in threat mode, tinnitus will feel louder and more intrusive. We have to calm the emotional and physiological storm that the tinnitus sound creates. Tools here include things like mindfulness and relaxation techniques, calming the nervous system so your brain isn't stuck in fight or flight. Cognitive behavioral therapy principles, breaking the cycle where tinnitus causes anxiety and anxiety causes tinnitus to seem louder. Cognitive behavioral therapy teaches you to separate the emotional reaction from the physical sensation. And structured counseling, helping you reframe how you interpret and respond to tinnitus so it no longer controls your thoughts, mood, and quality of life. Pillar number 3 is a customized and collaborative plan. Remember earlier I said that there's no one-size-fits-all tinnitus cure because tinnitus isn't just one condition. It can be linked to hearing loss, neck or jaw problems like TMJ, certain medications, and other health issues. That's why a real plan has to be tailored to you and built on a complete evaluation to identify every potential contributing factor. This pillar can involve things like lifestyle and wellness coaching. Diet, exercise, daily habits can directly affect your tinnitus severity. Biometric monitoring, like tracking heart rate variability, sleep patterns, and stress levels so your plan is based on real data and adjusted as needed. And collaboration with other healthcare providers, possibly working with your primary care physician, an ENT, or your dentist to address any related issues when needed. When these pillars work together, they don't just mask the sound, they change how your brain processes tinnitus. That's the real goal, to help you reach a point where tinnitus no longer dominates your life. You know, this reminds me of something that my tinnitus professor in school, Dr. Pavel Jastreboff, told us during our training. Dr. Jastreboff is one of the leading tinnitus researchers in the world, and he's the founder of tinnitus retraining therapy. I feel very lucky to have had him as my tinnitus professor during my doctoral training. At the very end of his course in tinnitus, he told us, just because I've taught you about tinnitus and the basics of treating it, don't you dare think you're qualified to specialize in treating tinnitus. You need a lot more than just this class to be a good tinnitus clinician. That really stuck with me. The truth is, most providers do get some tinnitus education in school, but they leave thinking, okay, great, now I can treat tinnitus. The reality is, true tinnitus specialization takes more training, years of hands-on experience, and a commitment to use multiple evidence-based tools, not just one. And that's why so many people end up in my office after trying treatments that never went beyond just hearing aids. So what does a true tinnitus specialty center like ours do differently? We start with a complete tinnitus evaluation, not just a standard, hear the beep, press the button, hearing test. We evaluate the entire auditory system with tests like tympanometry and otoacoustic emissions. We do further testing to measure your tinnitus pitch, tinnitus loudness, and masking levels, and work to identify any potential other health conditions and lifestyle factors that may be contributing to your tinnitus symptoms. Then we create a multi-layered treatment plan. Hearing aids are only step one. We map out complementary therapies from day one, and we provide long-term follow-up care. We know that tinnitus changes. Your treatment should change with it. We schedule regular check-ins to tweak sound therapy, adjust strategies, and tackle new triggers. We track measurable outcomes. Using both patient feedback and biometric data, we can see what's actually improving and what needs adjusting. We address the whole person. We talk about sleep, stress, nutrition, mental health, because tinnitus doesn't exist in a vacuum. Contrast that with most hearing care providers' idea of treatments. You're going to get a hearing test, maybe a hearing aid, and you're told, wear it more. That's it. Which may help some people, but most people need more help than that. Let me tell you about Steve. Not his real name, but a real patient. When Steve first came to our clinic, he had been living with tinnitus for 7 years. He had a mild to moderate hearing loss and had been fit with a quality set of hearing aids, but his hearing care provider told him that that would help. It did, a little, but not enough. He told us that before tinnitus, he'd been a happy man, but now he wasn't so happy. The ringing was keeping him up at night. His stress and anxiety were through the roof, and he'd stopped doing many of the activities he had previously found enjoyable because the tinnitus was nearly unbearable. Here's what we did differently. We fine-tuned his existing hearing aids using real ear measurements to ensure the programming in his hearing aid was right. We got him started with linear bimodal neuromodulation treatment to help retrain his brain's sound perception to the tinnitus. And we gave him My Tinnitus Therapy, our program that teaches mindfulness, relaxation, reframing, and breathing exercises to help reduce stress and anxiety, which had been fueling his tinnitus. We identified that late-night caffeine and iPhone scrolling were major sleep disruptors for him. We set him up with biometric monitoring to monitor his heart rate variability and sleep quality. And we scheduled regular follow-ups to adjust his plan based on real data. He came back to the clinic 3 months later and he told me, I'm back to being a happy man. I hardly notice my tinnitus anymore. His perceived tinnitus volume had dropped by over 50%. He was sleeping through the night and returned to the activities that he had been avoiding for years. That's the power of a multifaceted tinnitus treatment plan. It didn't just change his tinnitus, it changed his life. So what to look for when you're trying to find somebody who is a qualified tinnitus provider? You should ask them these questions. How long have you provided treatment for tinnitus? Do you have any specific tinnitus certifications from recognized bodies such as the American Board of Audiology? Do you offer multiple evidence-based treatments for tinnitus, or is it just hearing aids? Do you know and follow all clinical guidelines for treating tinnitus from recognized professional bodies such as the American Academy of Otolaryngology? Will you create a personalized, multifaceted treatment plan for my tinnitus? Do you schedule regular follow-ups to adjust my treatment? And do you track my progress in research-proven, measurable ways? If the answer to any of these questions is no, you are not in a true tinnitus clinic. If you've tried hearing aids for your tinnitus and you're still struggling, it's time to get a full treatment plan, not just one piece of it. I know everyone's tinnitus journey is different, and I would love to hear yours. What's the hardest part of living with tinnitus for you? And have you found anything that helps? Let me know in the comments. Remember, tinnitus may be common, but living with it at full volume is not your only option. We just talked about why most tinnitus treatment plans fail, but the next step is learning which treatment plans actually succeed. In my next video, I'll walk you through the proven, science-backed options we use every day in our clinic. Click the link right here, and I'll see you there. Thanks for watching.